interstate. I'm not trying to laugh, but I was reading those articles a few days ago going, oh my gosh, a person would actually think that they could use their GPS to navigate through a blizzard. I grew up in that area, and the snow comes down by the foot per hour. So
well, they're getting feet. I mean, they've had over 100 inches, and you see these videos of their houses are just buried.
Yeah.
And it's breaking windows and
the chairlifts. You can't go up in a chairlift.
No, it's awful. It's really, and I love snow. I see it and I think, whoa, that's terrifying. So I have started recording. And have we got Allison? Yes, there she is. I think I'm going to turn this over to Allison. It's up to you, Allison, how you want to do this. But before I do, I just want to say, I just got to be in a breakout for the first time. And it was so, I feel like I've missed out on so much. The discussion was so great. So that was really fun. And I felt like I was being very rude because I was constantly responding to emails around the meeting issues, technical issues, which is why I'm not usually in the breakouts. So anyway, Allison, do you want to take this? We've got to do the report outs. Do you want me to do it?
Why don't you do it? People are tired of my voice.
Okay, then I'll call on you last for the last report out. And I think Cheryl's going to do the report out from our group, and she's got to log out and come in on her other phone because she doesn't have power and her work phone is dying.
I'm here, Kathy.
Oh, you're here. Do you want to just go ahead and do the?
Yes, I would love to, because my phone's about to die and it wouldn't let me use my personal phone. So here we are.
Okay.
So thank you. Amazing conversation. I think one thing I would say is just in general, the video, I think, really connected with just having dialogue about how we need to be more conscious of ourselves, caring about ourselves, and making connection to other people. And the piece I think spoke to folks about was, really when the video speaks to like how we solve this, and that it really is about connection and community, and highlighting that, and that we know social isolation is such a predictor for having depression and anxiety or symptoms of that. And so really being able to think about how we connect together. And so folks in general, I think really that resonated the message in the video with how we would like to see things happen. And then also talking about how important it is. It felt like there were some major components in making sure that we're supporting peers, and those being livable wages, really valuing the role, and then professional development and support. And so, there was a comment, we know that we're one of only 2 states that haven't done peer credentialing. With that said, we haven't found any other state that really has figured out how to do this to make it a livable wage and to really value work and having peers in a way that connects with the way we would like to see it. And so making sure that we're highlighting that, and then also making sure peers are at all levels of any role. So at a foundation level, that across organizations, seeing that happen. And again, I think speaking to the value of that, we also talked about how with peers being a support in primary care setting, but really I would say any setting, though when there's peer support, there's really the ability to dig deeper into what's going on for someone so that they can access their support, and looking at symptoms and the struggles rather than a diagnosis. I mean, I think, we all know we have this medical model and it's driven by billing, insurance, and other places, but that when we're able to talk to people at an individual level of what their experience is and how there can be support in the right way for individuals, how important that is. And then we also talked about some key places. We already have recovery coaches and emergency departments. We have some designated agencies that already have peer support workers, and they are supporting that within our children's system, having peer supports for family members, for parents and caregivers, and really feeling like we have not arrived at this. This is a journey, and we have a lot more work to do to really get to a place, again, where there's livable wage and we're supporting and valuing peers at all levels in the way that we should be. So I would certainly welcome anyone else from the group if I missed anything. And Kathy, I'll send you these notes as soon as power and internet returns.
Thank you
Thank
so
you.
much. Thank you, Cheryl. How about Laurel and Kaya? Coordinated Services Planning.
Laurel,
Yeah,
I know you took notes, and I lost
Sure.
power and internet, so.
No problem. We had a small group, but it was a great discussion. So this is about how do we make sure that when teams are doing coordinated service planning meetings, and to ground it, I know Allison talked about it before, but it's part of our system of care for children, youth, and families under Act 264, which has been expanded beyond just children with severe emotional disturbance, but to children with any disability. They have the right to coordination of services if they get services from education as well as human services. And so there's a structure and a tool that can be used for that process. And it happens locally frequently, but there's not always the engagement of healthcare or primary care within that process. Some regions, to go to kind of what's already working well, some regions do that well, and they actually have input from primary care in advance of a coordinated service plan meeting, or they might have a nurse from the practice join the meeting and really be able to weigh in and also hear what are the concerns, what are the strengths within this family, and what are people looking for, and how can those services be better coordinated. So we want to make sure healthcare is a part of that process, not just social services and education. And so as our pediatric subgroup, we had done some brainstorming about some concrete actions we could take with that. And we discussed those a little bit more in today's group and kind of enhance those ideas. One is to really, thanks to Cheryl, who's our state interagency team coordinator. We're going to take this up at the March meeting with all of the LIT participants. So the local interagency team members come together once a month for some informal kind of peer-to-peer sharing of what's happening around local systems of care. So we'll talk about it with them and hopefully have those who are doing this well share how do they do it and what structures do they have in place, and hope that others can hear that and think about it. And there might be some more formal recommendations that come out of that discussion that could lead to other structural changes, whether it's to the tool itself, plug your ear, Cheryl, because we try not to change it too frequently, or just the process in general, or our guidance facilitator guidance document. So that was one piece. We've also talked with Julie from Blueprint about joining kind of a lunch and learn type process with community health teams so that we can talk with them about what is this coordinated service planning process and tool, and how could they be a part of this. But it led us to think about how do we kind of how do we demystify the use of the tool, the facilitation of these meetings, and really have it be shared by more folks, because right now it does kind of fall on the shoulders of a few in regions who are then doing multiple coordinated service planning meetings a week on top of their regular. I mean, it's part of their job, but it's become so much more in use that it's really impacting their ability to meet all of the different requirements. So it's not, there's not the mystery to it, but we want people to first know it exists, know what the resources are to support it. And we were thinking about, are there ways to do some different approaches to training on what is Act 264 and coordinated service planning, and what is this tool, and how do you facilitate meetings to get to the 21st, 22nd, whatever century we're in right now. A lot of our training was developed back in the early 2000s or even earlier, where we had slide decks, and it was really great that some of our local regions who have done trainings locally recorded those and they're available. But I don't think healthcare is going to go and find that and watch, you know, a 2-hour training session that happened several years ago. So we want to do some continued thinking about how can we do some short snips of information about what this process can be and the benefit of it, and how can healthcare, you know, be a part of this, and just to get that information out and in the right places where people might see it and be able to access it. So more thinking is going to happen within our pediatric subgroup, but it was great to hear some input from this group today. We also talked a little bit, we felt like we kind of covered a lot within the CSP, and so we shifted and talked about some of the other recommendations of the pediatric group just to get input from this group who weren't members. And so there was some thinking also about how do we communicate better the pathways to care for children, youth, and families. So some good, just kind of brief, concrete suggestions about that, because it's connected in with this coordination of services. It's also, so you're coordinating, but how do you make sure that it's clear? How do you access the care? So it was a great conversation. I guess I'll stop there. I would say, as far as the video, we had some similar thinking as what Cheryl said, and really kind of broadly thinking about how we talk with each other is an important part of that, you know, relationship building and connectedness, and being aware of some of the power differentials that might come into play, et cetera. So I don't want to go too far down that, but Kaya, if you want to add anything, I don't know if we have time.
I think we just talked a little bit about calling out the elephant in the room, as someone said earlier, is that there are power differentials, you know, especially when we're dealing with physicians. You know, we call them Dr., you know, for most part, like Dr. Levine, even though, but when we're talking to Allison, we call her Allison. So there's some power differentials that exist that we need to really be conscious of and start talking about.
Great, thank you. Thank you both, Laurel and Kaya. Steve and Haley.
Yeah, thank you. I'm gonna go first, just give a brief overview of our discussion around the video, and then I'll kick it over to Haley around the discussion around performance measures. I think the video was, was good because it was talking about culture and the change, and, but it really highlighted, again, us thinking about, different health equity issues. I think there were some folks that were skeptical to begin with, but really thinking about the power of listening to each other, but then also, when we're thinking about those that struggle to get the care that they need, or, have to continue to advocate for things, how can you continue to listen, when you've tried everything under the sun, but you need to, or some of us that are trying to advocate for change, and how do we, simultaneously listen, but also make sure that we're advocating where it's appropriate and wherever it's possible. It was also highlighted, again, the use of the term behavioral health and how offensive that is to some people. And I think that that's really important for us as a, council and us as a state to continue to champion the, the appropriate use of different terms, and especially knowing that language matters. So when we use terms like behavioral health, and, Kaya, to the point you made earlier around those people that have been traumatized or negatively impacted, harmed by the healthcare system, that again, some of those folks don't want to engage for good reason with this type of process, because again, even just the use of language can turn people off. So I think it's important that we continue to be conscious of the, the language that we use, and making sure that that again, we're being sensitive around those types of things. I think the last point that I'll make, and then again, I'll kick it over to Haley, is just, how the video highlighted taking collaboration to a whole different level and really being thoughtful and creative about how expansive we are in the collaboration. I know for me, and co-facilitating this group since I've been at DMH, which has been the last 15 months, it's been interesting when we do have our work group meetings, or, we have breakout meetings around when we're talking about performance measures, what do people mean by that? and then who needs or who should be or who is not sitting at that table for the discussion. You know, me personally, I live and breathe quality all the time. It can get very complicated. But how am I inclusive of those, for example, that are receiving healthcare, and you know, folding their perspective into this work when we're trying to identify different measures. But again, also having some level of, for lack of a better term, a level setting, so there is, you know, at least a shared understanding of what we're talking about, even when the topic being discussed is very complex. And obviously, getting into value-based care, that's a very complex discussion and topic. But yet, you know, I think it's worth thinking about, you know, being more inclusive of making sure that we're getting people's voices and, you know, thinking about the measures that are being collected, not just, again, from the people that are receiving the care, but also those who are providing it. So, Haley, I'll kick it over to you.
Sure. So we had a great discussion around key performance measures, and it really ended up centering around system and culture change. So they ended up being some pretty high level, big key performance measures. And so I'll just kind of go through the handful that were discussed. So we considered measuring what is the degree of culture change that's being embedded in medical education. For example, UVM Medical School and nursing school around whole health care and mental health integration. Because if we're not doing it at the medical education level, we're at least a generation away. The idea that physical health is also reflective of mental health. So there's a suggestion that we look at and measure physical health and work with providers of mental health services to hold them accountable for medical health as well, as the two things are so intertwined. And then in looking at agencies and services, performance measures around who are the people that can't be served and why. For example, you know, so often we're butting up against, you know, can't take a forensic patient, can't take a substance disorder patient, can't take an eating disorder patient, can't take a medically complex patient. And if truly integrated, the system should be able to serve everyone. We discussed measuring the transition from adult to adolescent to adult model of care. So the child and adult worlds are very different culturally speaking. And in terms of performance measures, what are the long-term health outcomes for those who had a successful transition from adolescent to the adult system of care, where perhaps the child-centered approach is a little more, it's more of a holding environment. And then all of a sudden there's the adult system of care, which doesn't provide that same level of integration. And when it is provided, you know, what is gained in terms of health outcomes. A performance measure around how well AHS is actually integrated across departments, like what systems are in place for us to continue doing this work and having these conversations, because if AHS can't do it internally, you know, how could we be asking that of the greater, very complex system? And then a few long-term things, very long-term performance measures that we discussed. How are we moving towards inpatient mental health care being integrated and not isolated to freestanding institutions the way it often is in Vermont? And then actually, while this is very aspirational, we could measure how to make specialized care, such as designated agencies, how are we moving towards making them almost obsolete? Because if aspirationally, if it's a truly integrated system of care, you know, we wouldn't have these separate entities operating independently. I think someone had said if the council was truly successful, DMH wouldn't exist. So, you know, we kept it pretty high level. And I think it was a great conversation. So that's what I've got.
Thank you, Haley. And thank you, Steve. That was great. Allison, your group.
All right. I could have stayed in that room all day because we just had a great time. And there was so much to dig into. I think what we started out, one of the comments about the videos where we picked up also on the listening piece and just trying to think of space as we go where we have the opportunity and the time to listen. And thankfully this group is named as one of them, but we need more. And then also the statements around how there's a need for spiritual transformation. And we just discussed, you know, a little bit on the surface of what does that mean? Where are we having that discussion? Is it about values or is it about, you know, what's directing all of us? And so just muddling through that. But we just thought it was a really important note because we do agree, like, it's gonna take that type of spiritual and cultural piece to make change. And so where does that conversation happen? Some of the pieces that we dug into, I think I left lighter on my feet than I came in, because there were some really great examples of where leverage staffing and shared staffing is happening. And I thought that was really cool. If you want to hear some great examples, talk to George, executive director at HCRS. And I'm specifically not saying your last name, George, because I can never pronounce it right, Karakobakis. And I think
That's close enough,
good?
yeah.
All right, thanks. So I think one of the things that George highlighted, which I thought was important, is we talk about, we're talking about leverage staffing. Some of the folks, mentioned how, to do that, we talk about the need for trust, but that it's harder to have trust when there's resource scarcity. And so right now, in particular, with the cost of providing care and the staffing crisis, it can erode trust simply because people are a little bit pushed to their corners to try to hang on to what they need to keep their doors open. And so it just owning the fact that you might have trusting relationships, but a scarcity of resources gets in the way. But the group really did gel around the idea that we thought, sharing some of these resources rather than building or recreating them has some real good things, and that it can create, instead of just a referral or a handoff, really more of a connection and an integrated approach to resources and services. And I liked one of the things that was brought up was, you can think about this as, we need to build an infrastructure in Vermont that makes it easy to do this. And I think most of us agree it's not quite there yet. The incentives aren't totally there. Just even the mechanisms for how you want to go about it. It's an HR nightmare, for one thing. Sharing IT systems is hard. So trying to get to a place where we have the right ingredients to make it easier. But one way around that we're seeing people use is certain models. So if you choose a model, I'll name, one of the ones George talked about was the HealthWorks Assertive Community Treatment Program. That in itself was a model that required collaboration and different people coming to the table and giving of their time. Same with the collaborative network approach, as well as other trainings that help drive person-driven approaches like IPS, that's intentional peer support, and the Wildflower Alliance, who's done some work on alternatives to suicide. And so just picking models that we think support these values and applying them versus going straight to, how do I contract with an employee from another agency, could kind of help us build a bridge. And then I think the last piece is being clear about what shared or leverage staffing does do or doesn't do. So we had a little list of that it does strengthen system level relationships, IT collaborations, builds understanding of the value of disparate systems, but it doesn't, quote, trim the fat. It doesn't always give a client or patient more, and it doesn't create more time for the individuals who are shared to do additional work. And so just making sure we're clear on the boundaries of what this type of agreement can provide. Anyone else want to chime in? Did I miss anything?
That was a great summary, Allison. It was a really serendipitous discussion, both in its timing and attendees. So please let it continue. Thank you.
That's great. Thank you. I was only in one group, but hearing these report outs, I really like this topical. We weren't here before. We didn't have topics before, but now we've got our recommendations, and this feels really fruitful to me. When we get all the notes, if all the group leaders, if you please send me and Laura Lyford your notes so we can post them on the website. If anyone has thoughts, suggestions about, we've got 2 more meetings, April and July. I'm feeling like this could be really helpful to keep this kind of structure. This was Sam Sweet's suggestion, by the way. It's too bad that she wasn't here today. So if there aren't any other comments around those groups, I wanted to open it up for if there's any anyone else want to comment. We always have a public comment opportunity at the end of the meeting, and I'll just be quiet for a bit here and see if anybody raises their hand. I'm just scanning the list. I'm not seeing any raised hands. Thank you so much to everyone. It's been a little rough today. Power cutting in and out, and some people still don't have any power. And but again, I have found this really I've found it really uplifting, and it was really interesting to hear the discussion in our work group around the video. I'm going to send the link to that video and the summary. Well, I'll send you the document about the interdevelopment goals so you can see what those are. As I said, they're very focused on the United Nations Sustainable Development Goals, but I think in so many places where they say Sustainable Development Goals, put healthcare integration in there, and it works really well. This is a big, complex thing that we're working on. So I'll send that out, and please do any comments, suggestions, feedback, please do email me, let me know. Allison, anything, or anyone, anything more?
Just sincere thanks. I know it was a little bit of a nightmare this morning with the technology, so thanks for sticking with us. Really appreciate it.
Yeah. Okay, well, we can end at some, yeah, we're ending a half hour early. So thank you. And maybe Mo, do you want to stay on?
Yeah.
Okay, thanks everybody.
Drive safe.
Thanks, everybody.
Thank you. Appreciate
Yeah,
it.
stay safe, anybody driving.
Bye-bye.
Thank you.
Thanks.
So, as
Okay.
always, lovely job.
Oh, thank you, Kaya.
So I
And
always
you're-
going to just stay behind because you cheer my day up when I talk to the two of you.
Well, you cheer my day up, so I can't speak for Mo. I've noticed, I have to say, I've noticed for Mo, the sun has risen.
That's right. Now it's now 9 o'clock in Victoria on Vancouver Island. So
Well, I was right in the middle of the breakout group, and my power and internet both went down at the same time.
Wow. Yeah,
And then
yeah.
they came back up,
Yeah.
which is good because I think we're on the same block as the local fire department. So they
higher
pull us up.
priority.
Yeah,
Good idea.
You get it
Right.
back soon.
All right.
but yeah, and we had a great discussion about the video. Actually, that's where I brought up the whole equity thing about calling people doctor versus their first names. And I just called out and said, we have some real power imbalances that we feed into.
And I think though it's even what do we mean by power? So right now a lot of it's power over versus power to.
Yeah.
And how do we do both then? The building's on fire. You don't get to debate which exit. You've got a fire route. So I think it's always in that both end. I know, George, you've
He's
hanging on.
Frozen.
Oh, he's frozen. Oh, okay.
Totally frozen.
Okay. I just, for a moment, I was thinking, okay, but I didn't. But anyway, no, I think it's fine. And I'm glad that Allison, set it up and because it takes courage to show something that seems so far away. But if we're not in that leading 5% of differential thinkers, the adult development high end, that's what Robert Keegan talks a lot about. We don't need everybody to be there. We just need enough leaders at all levels of the system to be thinking that way.
Mhm.
If you have between 10, 15%, the world then changes because the middle part follows the social proof that the others create. Now, did you get a chance to look at the resources? I know how busy you are.
Yeah, I'm gonna do it
No,
today.
that's
'Cause my afternoon, I was supposed to be doing a training for people, and they just emailed me to cancel because half their staff has no power.
Got. Well,
So I
let's
will
at
look at
some
those.
point, let's kind of,
Yeah.
no rush, but just get a conversation going, because how do we, the thing about culture change, a
Mhm.
lot of it is, as I think you would agree, there's the combination of covert and then the more middle senior who have influence on leaders. Like
Mhm.
people always say, you got to get the executive director, the CEO. And I always go, that can be the kiss of death. I was on a plane and I heard this person and I read this book. But if you can get really good, influential people at the levels of the two of you,
Mhm.
that then you've got the Allisons and you've got then the Dr. Livy. But it takes, somebody needs
Yeah.
to break through that can meet both
Yeah,
ends.
well, that's what I'm doing right now. I'm engaged in a project, which I think Kathy would probably find interesting, with Katie Whitney, who's our workforce development director. And the two of us created what we call the Agency Learning Cooperative. And we are going throughout the state. We're going to each district office. So
Right,
we're going to them rather than making them come to us, and doing day-long trainings. And then and it's a training workshop time for conversation. And
That's
then
that's the only kind that really works. Ahead of
and
time, send them stuff. Yeah.
and then we create a Teams channel where each just office has its own Teams channel where we'll be talking to them in between and doing online stuff.
That's
And our plan is to probably hit them every 6 months, between 6 months to 12 months, depending on how fast we can get through. We go back. And we did the first one, and
great.
oh my gosh, it was the reactions we got and the things they've already started doing. Like one of the things that they realized, because we pulled everyone into one room. So we had corrections department of children and families, the health department, everyone in that town who were middle managers or supervisors, and even the higher level came to this meeting. And at the end, they were saying, they're talking with us, and they're like, you know what we should do? We need to have a monthly meeting of all of us together. And they've started it.
That's what brought Kathy and I together,
Yeah.
was this concept.
Yeah.
Anyway, well, set up
Yeah.
some time and I'd love
Yes.
to chat.
Okay,
And I love
before
that
you go.
term cooperative. Perfect.
If you are interested, if you want to send me your personal email, I've
Mhm.
started a newsletter on Substack about the interdevelopment goals.
Yes.
And you might be interested. I thought, oh, but I don't want to do it through work. It's totally separate.
Yeah.
So if
Well, that's
you're
like my
interested,
whole self-care stuff that I started through work, but it's taken a life of its own of people just reaching out from all over the state, as I am now the expert because I'm framing self-care so differently and changing the conversation. So
yeah, well, send me your home
Yeah,
email and I'll send you
will.
the link. Great.
Okay.
Take good
Thank
care.
you.
Yep.
It is a joy and you look great in that color.
Oh, thank you. See ya.
Bye.
Bye-bye. Cheryl's just texting me. Yeah, that actually, I thought it went. And Mo in our work group, saying, wow, what'd you think about the video? People, they were very positive about it. And
See,
hearing those other work groups report out, that people heard that.
and
More so than our facilitators did the first time around.
well, I think in fairness, what happens is the facilitators come in feeling they're the experts and they have to hold on. You and I know that. Like there hasn't really been there's been a breakthrough, but there hasn't yet been that. They're breaking through, they just don't know it. But when you get in, if one person suddenly shifts, and it all begins with what the question you ask. And I thought I liked the way Allison said, when Dr. Levine and I looked at it and we just felt it was too high end, like she named it.
We talked about that when I met with her. Because she clearly had some real, hesitation.
Yeah.
And I said, Allison, just tell them you thought Mo and I were out to lunch. You thought this was, I said, if you can make people laugh, do it. Fine. Tell them you thought I had just taken, so we talk about that process of, what is this? No,
I was delighted, and I just want to say it's another example of where you stepped in. I mean, it's, you're like me. You watched that and you went, holy moly! This helps summarize. It takes the complexity and speaks about it. It's still it's like the guy at the end said, these are difficult skills, but they're necessary skills. So they're not the skills for everybody at the beginning, and they may never be. But it's that idea of like where you just saw them, you did the blog. I mean, that's to me, to get Dr. Levine on is not as important, because if people see him shift and change during the process, they're more like, oh, okay, the system's supporting me. But yeah, I thought, I laughed because I thought that this is real life. Real life is, I've been traveling, I get up at, 4 hours sleep, get up. And I thank you for that text, because that was helpful, because my alarm had just gone off and then your text arrived. So it was kind of like, it was like that gentle nudge. But I think that's it. And then the power goes out. And that's the thing about complexity, is we don't know what we have control over. We could have the most perfect system and everybody shows up in good behavior and nothing. But human systems, when there's flaws and we work through them together and everybody's struggling, suddenly that's that community coming together. And I love that term. I've been thinking a lot about it. The difference between, I came across something, it was to do with communication, and they said, when we started off, we were in caves, it was oral history. We had some drawings on the wall, and then we move over to the left and we got into where the monks, 4% of people believe could read and write. But when you looked at the manuscripts, there was pictures in them and color. And then we move up to the printing press and it became black and white. And now we've moved over to the access to video and audio. And what was interesting, the 4 quadrants, each one continues on, but the left-hand side was cooperate. No, the right-hand side was cooperate, and the left-hand side was work. I can't remember the term, but it was like one of those. So we're collaborating. So one was collaborating, which is very goal-driven, and cooperating. And their point is, to be in the cooperating side, you need to be part of a network. You need to be accepted into the tribe. The others, you can demand your way through it. So it was quite interesting.
Yeah, no, that's good.
Yeah.
There was all the talk about, the meeting is so long and we've got to do it shorter. And I sent out the email saying, please come and be there. You're important. We had 40 people to start. We had 30 people.
I know, at the end. I mean, and did you hear what, I think it was Allison or somebody said, and there's too few places you can be heard and listen to each other. And this is one of them.
People named it. Yeah.
So they named, so this is, and because it's not about coming out with the tick box, do we have stuff that others have to implement? It's like, let's just play together. Let's just have this cooperation. I thought, and I agree with you in that now they're ready for the topics. They weren't ready until they had something to say, here's where we want to go. And now they can play at the overlapping and.
Yeah, and I think that we just continue to do that. Here's these topics, go wherever you want.
Yeah.
And keep mixing up the facilitators, which I think can be really useful. And if we can get Sam and Julie there, and I'm going to do an old school power move and go to Allison and say, please, the message has got to get through. This has got to be prioritized. Sam's got to be here. Julie's got to be here. And they keep,
Julie not come back, because I thought I saw her.
She did. But she went off to another phone call. And it's just like, no, this is once every other month.
Well, I'm hoping that your recognition of Sam, you were very generous, and this was Sam's idea. I think it's a great thing to say, Sam, your idea worked so well. You need to be there, because you are a leader in this group. You know,
Yeah.
you can influence. So, but I agree with you. It's kind of like death and taxes. Like sometimes you've just got to say, there is no choice. There is one exit route that we have planned and you need to be there. And that's where I feel like when I was the empowerment angel back in the 90s, that's where we dropped the ball, because or like the psychological safety, Amy Edmondson, the one that says it's difficult to learn when you already know. She has this matrix, and it's psychological safety and accountability. So if you have neither, you're, disaster.
You got nothing.
If you only have psychological safety, it's kumbaya. And if you only have accountability, which is where we tend to be because of the KPIs and stuff, you have anxiety. And when you have both, you have a learning environment. But you need to have both. It can't just be one. And I think that's the part that we should think a little bit about, that around how to get across the both and more.
Yeah.
Because that's what I find is once people start to understand navigating polarities, they get it. They can hold the tension of both and.
Right. Yeah. No, I was really, I don't know. I think that was actually I think that was I don't want to overstate it, but I think that was just a hugely positive meeting. And I guess, part of it was I was coming into it with, Allison and Dr. Levine saying, this is such a long meeting. We have to shorten this and and I'm so glad I just came down to no.
Well, that's you see, you're the gatekeeper, and you're a reasonable gatekeeper, because we kind of went, well, we could do this, and then people could drop off. That's and I keep going back to John Curry, the 75-year-old doctor that I've started to get to know. It's like he's like, nobody's ever pointed out, Mo, the inconsistencies, and that's the thing. That's the job you do so well. Is you hold the line, and you know when to, I think both of us have that, well, we could, so we don't go no right off the bat. It's like, okay, no, it does. And now, what did you think about OneCare?
I thought, well, at first I was just like, because of the time, and Allison, she is so, as I said, I wish I could clone her a million times. She's going very slowly, and I was sitting here thinking, Kathy, stop it.
I know you and I are so bad because we think fast.
Time we're supposed to, and Allison's like, and does anybody have any questions? And I was like, oh God.
And then some of the ones that came up were quite interesting,
But then, and we get into the OneCare thing, and then she was saying questions, which we've not done that for very specific reasons. And I thought it went beautifully. I just thought, and I was thinking, see, we've set a culture now. And instead of, it might have been the first meeting when you weren't there. Our very first meeting, we had the chat on. And people like Ann Donahue, Dan Toll, Will Eberly, people who were in the meeting today, Alexis, all from like the advocate world, they were in the chat taking DMH down. It was so bad. It was just like, are you kidding? This is what you're going to do with this? It was so bad. They're posting all this stuff. It's like, we're having this discussion and you're doing this, it was just
you're not listening. You're not, you're in a debate. You're arguing over the person.
So then it was like, fine, we'll shut off the chat, which I really didn't want to do. We're trying to have this, but you can't really, what do? Say, stop. Wait a minute, this is in the chat. Wait, and they were behaving like bad school children. I mean, it was just like, oh, geez. Well, we've had the chat off this entire time, and it's one of the reasons that we haven't had just like questions, because it can devolve so easily. And today, I don't think you could have asked for, there were a couple, but everybody, that happens all the time. and I just like, wow, we have moved. I mean, this, and that it could be one care, because boy, they can be a punching bag. And I thought Mike Fisher, he was really good. He was respectful.
Yeah.
He just said, I'm wondering if the emperor's got any clothes here,
Right.
you know, which they've got to hear.
Because I must say, as I listened to it as an outsider, now granted, I hadn't had a coffee. I went out and got a coffee during the break. I was thinking, oh my God, they are so insecure the way they keep saying, and we're doing a fabulous job. And I thought, you know, if you're doing a fabulous job, you don't have to say you're doing a fabulous job. So that was the part. And then when Allison said, tell me a story, they went into listing their projects. And so I thought it was interesting. And I think part of it, you know, because at that time I'm jotting down going, does this woman know how to do a story? But here's the thing, I think also, in the past, some of the keynote or some of the interviews have been very kind of wow. And then we put them into more subdued dialogue. And it was interesting. It was good to know, but it wasn't a wow, I'm coming away from this with also, that's just me as an outsider. And then the provocative video, like I learned that a few years ago with appreciative inquiry. You can get people to do the discovery and the dream, but if you don't do something provocative before the dream, like do the discovery so they can learn what they're doing well and where they want to go and what are if you had 3 wishes, you can still kind of tie it in, but there's a need to be provocative. And now, because I did that with UL back when, and then before they went into design, I let them do the dream first. Before they went into design, I showed them a video on blockchain, and it was stories of how it actually democratizes, because people can share money for next to nothing immediately. Nobody's holding it for 10% ransom. You can do Spotify and all that stuff. But I've decided now that more than anything, if you don't come up with something provocative at this point, they just fall back into a 10% improvement and think they've done incredibly well. They just, and I believe that today, listening to people, they were able to get it, that this isn't about healthcare. This is about the world and adult thinking. And that, you know, if we got 15%, if we got 3 to 5 people who made that transition, and I think it was much more than that, the chances are when they go into another conversation, they can't not think about that.
Right. No, and thank you so much, Mo, for bringing that video, because I'd never heard of it. I mean, you brought that in, and it's really, I just think it really is a game changer, because it changes your frame. It just changes that whole. And you know what I'm wondering about the April meeting? Dr. Levine had said, and I think it's a very good idea. He wanted more on peers. And I want to contact these people in Georgia who have been doing the whole health model with peers for 10 years, for a long time. And I'm wondering, and you know, I can have, it's 2 months away, and I could see, like, do you have a few people who could be available to us, Georgia, where we have a conversation and maybe it's open like that? And there are questions and discussion, and then we take a break, and then we go into perhaps it's 4 topical groups that are around performance measures, shared staffing, but with peer, it wouldn't be shared, I don't know, but
no, but I know what you're getting
peers.
at. Topics that say where are the 4 areas that peers would make the most impact immediately. And I'm wondering, and as we're
have people from Georgia, maybe one person in each work group.
Exactly. We're just on track, because as soon as you said that, because again, it's the social proof. It's in the moment someone said, well, let me tell you about this person that walked in. That's the difference between when you're trying to orate and be the sage on the stage, you're trying to find the average story that will cover. But when you can, in the moment, go, someone says, well, that's okay, but it wouldn't work with a 13-year-old who's got anorexia, that's got a family that's fallen apart. And they go, well, let me tell you. And of course, being from the South, my bias is from my old mentor and people I met, they're more story oriented.
Oh, I thought you were going to say being from the South. being from the South, people in Vermont, and I'm going to stereotype Vermonters about stereotyping Southerners, but Northerners are going to be expecting a certain thing, you know, a not sophisticated level. And here they're way beyond us.
Oh, and
this.
that's, yeah, people mistake. It's like when they started doing call centers, when I was involved in setting up our call center, and I went to conference and went all over the place back in the early 90s. As they were being born, all the call centers were in Kentucky and places, because nobody wanted the New York fast talking, and nobody wanted the Southern slow talking, and the California. So it was quite interesting that was in all the conferences. Yeah, you know, we'd really, and then of course everybody went to India and places, so
Right.
they're worried about different biases and accents. Now but no, I feel very privileged to have walked this journey with you on this, and to be able to see the transition and to see how the world is moving. I mean, you think about it, just like the other day, my friend's son had received about 18 months ago, 5 million for his startup on artificial intelligence and HR. And then his funders came back and said, no, we're not going to give you more money. It has to last a year and a half, which was okay. But they were the ones saying, you got to hire. Well, of course, where's the money? But in the Silicon Bank. And so the chances were, so on Thursday, as his mom's going into hospital with something, he gets, he calls her up and he goes, it looks like, we might at best get 10 cents in the dollar, or maybe we'll get nothing. And then, of course, the federal government stepped in, as well as the finance, and gone, we cannot have run, because they know the 1920s. But it's ironic, because this bank was started up by the Silicon Valley funders, angel people, and they're the ones, go there. And that's why half of the startups are there. And they were the first to say, get your money out.
Yeah. Are you paying attention here, what you just did?
It's just like going back to David Curry, and it's just going back.
Do you understand how a bank works?
and the psychology of it. And I think this is something for us to be thinking about. And I feel like that's why when Jervis Bush and Bob Marshak started the dialogic piece, and that's the difference, as they would say, everything else we're trying to change behaviors. Oops, I think you've blinked there. But when you can change mindsets, the behaviors align.
Right,
and it's it's harder in some regard, because you got to kind of jolt the system. But once you've moved, you can't go back to not knowing what you know. And so, kudos. And I mean, I just keep thinking about that first conversation you and I had, because you had contacted Lindsay and everybody else was busy, and she passed it to me, and I'm like, okay. I'm free the following. And it's so fun, because some of my best experiences have come from this ad hoc. Well, I'm free. Okay. Well, and I can still remember our first conversation. It was just so, it was so invigorating and open.
Oh, that's nice.
Yeah. Because you weren't.
Mo, I don't know what you're running on. you
It's my coffee. I had to have a large coffee. That's what it is. Anyway, young lady, I think I think the Georgia is perfect. And just to do, and ask them if they'll do that.
And spend 4 hours with us, and that'd be great. They don't have to travel. So
no, but here's the other thing is, could you bring in someone? What am I going to? I was going to say something as like, that's you, about how to write that up. To be able to do like an article that could go out beyond Vermont, but just to recognize these people from Georgia and what they did.
Yeah.
Because I think that's the part that's often missing, is it could be in a case study or somewhere, but where is that richness of the story?
Yeah.
Here's where we're going. We brought in, I just offer that, because that could be a nice
that's interesting
thing for them. Not to give you more work.
Thank you so much. And I hope your time there is relaxing and fruitful.
Yeah. So what I'm doing is looking at from Eastern Standard Time, kind of 7 to 1 for you. So if there's any calls, like that's basically what I'm looking at, because I'm not closing down. I just want
Right.
to. And then that by then the afternoon part becomes some, I can book things for afternoon and evening and weekend. But
Yeah.
no, don't hesitate if there's anything. Okay.
All right. Thank you so much. Thanks.
Congratulations. Bye.
Oh, thank you. Bye-bye.